Dr. Sonam T Nyatsatsang has been actively involved in treating COVID patients along with other frontliners ever since the pandemic hit the world. He is an MD, MSc infectious disease at Swedish Medical Center in Seattle, Washington. Today we are going to talk about his experience with the pandemic, the present scenario in Washington, and about the virus itself. Tashdile Dr. La, and welcome to our show.
Thank you for having me.
Dr. La, in the course of working in the hospital and dedicating yourself in treating others, you yourself have just recovered from COVID. How are you feeling now?
Well, I'm doing great. I've been back to work now, second week back to work, so out for a few weeks.
How is the overall condition there in Washington nowadays?
Well, it is quite better. We were the first state to have the COVID outbreak. The authorities, the governor, they were very proactive. Obviously, across the United States, there was a big issue with availability of the testing. And in the beginning, everybody was scared. We want to do something for those who are ill. So we were trying whatever we can without much evidence to back with what we are doing. But the most important thing is the supportive care. And then as 1 week goes by, the second week comes in, we get more comfortable taking care of our patients, and we were more diligent with how we use our drugs, including the famous hydroxychloroquine drug, which most sick patients were getting in the beginning, but then we kind of geared towards more clinical trials than using drugs just for the sake of it, without lack of something effective.
Can you share with us your experience in treating the COVID patients and yourself getting infected with this virus?
Initially anticipated a large number of patients coming in, so the whole hospital is geared where we canceled all elective surgeries to create beds. The hospital admissions, we were more restrictive. We created floors to accommodate the COVID patients to have what we call as negative pressure rooms, where the air will flow in and air will not flow from the room to outside. So all those preparations were made. Then when the illness started, as I mentioned earlier, we wanted to do something, but we do not know what is more helpful or more harmful, And so we were using a fair number of hydroxychloroquine, but we were lucky to have access to this trial by this drug called remdesivir, which now has been shown to be the first drug to be clinically proven to be helpful. And we've been also using other drugs that are in trial, because now we know that it's not just the virus that is causing the illness. After the initial phase, there's the inflammatory response, the immunologic reaction that is driving actually the most severe illness in the later part of the disease course. So we've gained a lot of experience, and now on the treatment front, we are mostly restricting to clinical trials other than remdesivir, which has now had kind of proven, but it's not that effective, somewhat helpful. So mostly on the treatment front, that's what we are doing in the inpatient front. And the outpatient front, it's basically symptomatic treatment. You're taking your painkillers for your headache or body ache, or try to calm down the fever. And mostly it's supportive treatment for the outpatient front. One thing from my experience was I had some fevers, chills, and those were my main symptoms. I never developed any cough during the whole 2 weeks of my illness. So this kind of illness are considered mild, where you don't have a lot of respiratory symptoms, a lot of lung infection symptoms. So I was just at home recovering. So since you asked about my experience, the process at our hospital was when somebody gets COVID-19 and they get sent home, we send them out with a thermometer. So I have an example here. It's just a thermometer. It can come in, the oral one, or it can come in the temporal one, but this is just the one in the mouth, cheap but reliable. And then they send us out with a pulse oximeter where you put it on your finger and then measure the amount of oxygen in your blood. And then they send you through your phone 3 messages a day asking you what you're recording. So they monitor and get you into the hospital if they need to as soon as possible.
You said that you were at home when you got infected with COVID-19. So what kind of treatment did you undergo in your home?
Yeah, so I did not take any treatment. I had a mild illness. And in fact, so of the people who get the illness, probably 85% will get a mild illness. They do not need any specific treatment, just symptomatic treatment. So
how long does it take to recover from the mild COVID?
Yeah, so if you have the diagnosis and you do not have any symptoms, that's one thing. Right now, the directive is you stay away for 10 days and then you can come back if you don't have any symptoms. For me, I had the fever, the mildest symptom. I was out for 2 weeks and then additional week because at the end of that 2 weeks, I had a mild cough. So the requirement for us is you don't have fever for 3 days without any fever-reducing medication. And if you have symptom of cough, that the cough is significantly improved. So it can take 3 weeks for the mild illness, 2 to 3 weeks. But for the hospitalized patients, that is a tough case. Yes, somebody can go out in 2 to 3 weeks out of the hospital to home, but some people can be on the breathing machine, the ventilator, for a month or plus, and that's one aspect. Another aspect I would like to add is the difficulty with treating, especially in inpatients, but also in some of the outpatients, is the prolonged shedding of the virus. So when they put a sample into your nose, they find the virus, and then in some cases, we don't do repeat testing at the end of the illness or when you recover in every patient. But there are instances where we have to do it. For example, we discharge a patient to a skilled nursing facility or what we call as a nursing home type for them to recover more before it's safe for them to go home. And since those nursing homes are congested areas, high-risk area for other residents of the place, we usually try to screen them and see if they're negative. And we have seen cases where people are positive a month later, and now we have cases where people are positive 2 months later. And with the recent news, George Floyd, who passed away at the head of police in Minnesota just on end of May, he was COVID positive, actually, beginning of April. And after his death, the autopsy has to be done. And he was still positive, and that is like 7-8 weeks later after he tested positive. So that's one of the problems. And we do not know yet if these patients can transmit the disease. The general understanding is that they are usually not a risk to others to transmit it. But that's still unclear.
And also talking about the challenges being treated at home is that if you have elderly and young family members at home, then there is a high chance of getting them also infected. How did you deal with that?
Yeah, so before I got ill, it was almost 3 weeks or so prior to that. So when I come home, I change in the garage. Then put on a robe and go up straight, take shower, and I stay in my own, my son's room basically. It became my room where I do everything there. I did come down to eat, but I don't eat with my family. I was eating separately. In spite of that, I got sick, and my wife also got a little ill, but she got much milder than me. But once I got diagnosed, then at home I was totally in my bedroom where food and everything I was, served in my room.
Dr. La, we have heard that when this virus is infected on an individual, sometimes the symptoms does not show and the person suddenly gets to know that he or she has coronavirus. In that case, how can one stay vigilant?
Yeah, so that is true. You may have the virus and not know for a period of time. So we can call it the pre-symptomatic stage, and then you can have the symptoms of the illness. And you can show symptoms anywhere from 2 to 12 days mostly, but it can be a little bit longer. But there is a large segment of those people who are infected who do not show symptoms throughout their illness, and we call them the asymptomatic. What proportion of these people are pre-symptomatic or asymptomatic, we don't know for sure yet, but at least what we do know from a recent paper, a collection of different papers together, at least in that paper, they've mentioned that maybe more than 40% of the people have the virus and do not know about it. Now, this does not mean that they will not develop symptoms a week or so later, right? So it's not a longitudinal study where you do this. And there are a few studies where they have done longitudinal studies. Some of them showed many of, at least in those papers, many of them do not develop the symptoms, but there's another that shows many of them did develop the symptoms. So it is kind of different people looking at different things, different population. There is a large chunk. Now, what can we do about it? The most important thing is educate ourselves. What are the symptoms? What are things you need to watch out for? So education, being up to date. And in one aspect, in the beginning, we didn't know much. So most people just thought fever, cough, shortness of breath. That's what everybody heard. And then as we learned later, people may not have fever throughout the period or may not have cough throughout the period. It may just be significant weakness, malaise, fatigue, or maybe just fever, headache. Some people have diarrhea, and then some people just losing smell as the only symptom.
As per your experience, what is the most significant thing that we all should know about this virus?
Well, that it respects no skin color, respects no age, respects no, faith or country boundaries. It can infect everyone. It doesn't matter if you run, 10 miles a day, or you lift 200 pounds of weight in your gym, or you don't have any illness otherwise. It can and make everybody really, really sick. Now the caveat is, most of people who do die are the elderly, more than 60 years old or so, and also people with other, what we call as comorbidities, other illnesses, including, say, chronic lung disease or heart disease or kidney disease. So there are chronic illnesses that you can have a worse outcome. One thing is, even though most of the people who die are the elder ones, but at least, the younger age form, under 60 form majority of the people who get infected, right? One thing is, it appears women may be better protected than men. People who get hospitalized or severe disease or death is less in women than men.
Dr. La, everyone right now is waiting for a cure for this disease. In our previous interview with Dr. Kalden La, she told us that for a vaccine as a cure for this disease to come up, it has to undergo a lengthy process of validation that would take longer than we think. Please tell us, what do you think is the status of the vaccine right now?
Yeah, so very true. In fact, vaccines usually take years, maybe 10 years or so before we get a vaccine. But here we are on a very, very expedited schedule. On the other hand, science has been progressing really fast also, especially with using genetic material for production. So just an update on the vaccine front. Right now, there are 120 vaccine candidates in this world, of which like 10 are undergoing clinical trials. Everybody has heard that it may be a year to 18 months, and that also is a very optimistic outlook of how soon it'll happen. One thing important to remind our viewers is you may have a vaccine. It doesn't mean that everybody who gets the vaccine will be protected. That even if the vaccine is only 50% protective, they will be very happy. Of course, if it's a highly 80-90% protective vaccine, we should be ecstatic about it. But I think people should not expect that, there's a vaccine, now everybody is going to be protected from it. That is often not the case.
Dr. Sonam, thank you so much for being with us and sharing with us your experience on dealing with COVID-19. Thank you for being in our show.
Thank you, Sonam.